Hello everyone. Today our topic is nuclear chemistry. Nuclear chemistry first became recognized as a potential medical specialty in 1946 when it was described by Sam Sheldon in the Journal of American Medical Association. Sheldon reported on the success of the radioactivity iodine in treating a patient with advanced thyroid cancers. Now we see what is nuclear medicine. Nuclear medicine, branch of medicine that uses radioactive substances in diagnosis and therapy. In diagnosis, radioactive substances are administered to patient and the radiation emitted is measured and location recorded. In therapy, radioisotopes are administered to treat the disease. Basically, nuclear medicine deals with nuclear reactions or reactions that happens inside atoms. Nuclear chemists may be found in different areas of research, including nuclear imaging in medicine. Nuclear medicine procedures are used in diagnosis and treating certain illness. These procedures use radioactive material called radiopharmaceuticals. Most common nuclear medicines are single photon emission computed tomography and second one is positron emission tomography. I will tell you detail of single photon emission computed tomography and positron emission tomography. Administration of radiation. The routes of administration for radioactive substance include intravenous injection. The radioactive substance is injected into a vein. Subcutaneous injection. Radioactive substance is injected under the skin. Inhalation. Some radioactive substance and radioisotopes are inhaled by the patient. Ingestion. Radioactive substance can be ingested. What is radiopharmaceuticals? Radioactive material administered to patients are known as radiopharmaceuticals. These consist of chemical molecule which determines the behavior of radiopharmaceutical in the body. The radiation emitted by the radionuclide may be detected from the outside the body by the radionuclide imaging device, a gamma camera, or may be detected in a sample of the body fluids, example plasma or urine. Radionuclide must have certain properties. These properties are emit only gamma radiation, emit gamma rays with a right energy 120 to 300 to allow detection by a gamma available, have a short half-life, cheap and be readily available. What is gamma camera? Basically, gamma camera is an electronic device used in medical diagnosis for imaging the disruption of radioactive compounds in the tissue. In general, it is device used for imaging in nuclear medicine for imaging the gamma rays emitting from the radioactive compounds in parts of gamma camera. First one is collimeter. It is like a filter uh, torrent known rays so that it passes only rays that are almost parallel with some others. Photo multiple tube, the machine reveals a bigger electron produced by the cathode. In the photo multiple tube base there anode, which in turn attracts such a large group of electrons and converted in the electrical pulse. For example, this is collimated lights. Photo multiple tube, this shape. This is anode and dianode, multiple electrons, electron path and focusing electrode. What is PET scan? Positron PET scan abbreviation positron emission tomography or PET is a medical imaging technology that enables physicians to view how organ systems of the body are functioning at the cellular level. This is the picture of PET scan, positron emission tomography. Positron emission tomography is unsuppressed as a definitive diagnostic tool because it can help the physician to detect disease such as cancer, Alzheimer's disease, determine appropriate treatment for that disease, and efficiently track the body response to the treatment. It was developed in the 1970s and it was the first scanning method to give functional information about the brain. Uses of positron emission tomography, patient with condition affecting the brain, heart, certain types of cancers, Alzheimer's disease, and some neurological orders. For example, seizure, pancreatic tumors, and lymphoma and colorectal. What is SPECT? SPECT, a single photon emission computerized tomography. This is the abbreviation of SPECT, and this is the picture of this SPECT. Scan lets you doctor analyze the function of some of your internal organs. A single photon emission computerized tomography scan is the type of nuclear imaging test which means it uses a radioactive substance and a special camera to create 3D pictures. For example, I see this picture. This is these 3D pictures and uses of heart imaging, brain imaging, and tumor detection and bone scan. Common nuclear medicine studies neurological. Neurological, first one is diagnose stroke. It helps in diagnose stroke, diagnose Alzheimer, demonstrate changes and disease in AIDS, dementia. Oncologic, in oncologic tumor localization, tumor staging, for example, at birth stage of tumor, identification of bone pain due to metastatic cancer. In renal, it helps in diagnose renovascular obstruction, hypertension, detect renal transplantation, rejection, or renal function. In cardiac, select patient for artery bypass or angioplasty, localized toxicity due to myocardial infection, chemotherapy infection, and identification of cardiac shunts. Safety in nuclear medicine. Too much radiation can potentially damage organs or tissues or increase the risk of cancer. However, when used for diagnosis, the level of radiation exposure is around the same as a person receives during a routine chest X-ray or CT scan. As a result, nuclear medicine and imaging procedures are considered non-invasive and relatively safe. Their effectiveness in diagnosis disease means that the benefit normally outweigh the risks. Nuclear medicine, radioisotope mostly widely used in medicine is technetium-99m, employed in some 80% of all the nuclear medicine procedures. Nuclear medicines basically involves exposure of patient and general principles of radiations protections. And nuclear medicine also described by three elements: clinical problems, radiopharmaceutical, or instrumentation. Is it clear? Hope you all of you understand. Thank you.